Alright class, so this is the first 31st slides of the knee and related structures PowerPoint. We're going to cover just the first part of that and the basics of it. I'm going to try to point out the major things that you need to know for the exam or for the quiz. The first things that you want to know are the four bones that we're going to be focusing on, which are the femur, tibia, fibula, and patella. And here are some of the major landmarks. Some of the things to note are the tibial tuberosity, the medial and lateral epicondyles, which can be found here. That would be the lateral epicondyle and medial epicondyle. And then also the lateral and medial condyles, which you can see here. These are the medial condyles and these would be the lateral condyles. Those are the things that you want to make sure you know. Also, as far as the tibial tuberosity, making sure you know that that's where the patellar tendon attaches. That's going to be important for some of the pathologies that we cover. Okay, so now we get to the meniscus. We'll look at the medial and lateral meniscus. The medial meniscus is more C-shaped, as you can see here, and the lateral meniscus is more O-shaped. As far as blood supply goes, as you can see in this diagram, the red zone, or the outer 1/3 of the meniscus, is going to be more vascular. You can have more blood supply there. So anytime there's a lesion there, there's a lot more chances of it healing on its own, and recovery is a lot better. As soon as you start getting into more of this white zone, then the chances of it healing are a lot less, and that's typically when surgery is going to be required. So as you look at MRI reports, those are some of the things that you want to notice, like what it says, and it will help you plan out rehab and then also just give the athlete a little bit more information about their injury. And as we talked about in class, the meniscus, like one of the major forces that is going to put it at more risk and create more injuries, is going to be the twisting motion or torsion. So as you look at how athletes are, or their mechanism of injury, you're going to be able to tell if a certain movement is going to create more risk for them injuring their meniscus. The next four things that we're going to look at are the ACL, PCL, MCL, and the ACL. So as you look at the first bullet point under each ligament, it's going to describe to you the origin and the insertion of each ligament. For example, the anterior cruciate ligament, it gives us the anterior medial tibia as the origin, and then it inserts to the lateral condyle. Posterior cruciate ligament says it originates in the posterior lateral tibia, and then it attaches to the anterior lateral surface of the medial condyle. The next thing you got to notice is the motion that each of these ligaments prevents. For example, the ACL prevents tibial internal rotation and anterior translation. So one thing to notice is that this same motion or movement is also what causes the most damage, or it can create the pathology of those ligaments. The other thing we're going to look at is, or that you can compare with this, or you can refer to, is going to be this diagram here, and you can see where each of the ligaments originates and where it inserts. And as go back and look at your notes and read about, or in your textbook as well, read about what motions put each ligament at most risk of tearing. You can kind of start to imagine how these ligaments are stretched or put into a very compromising position with those movements. So the other thing to look at is the musculature around the knee. Here we have the movements of the knee flexion and extension are the ones that can be controlled, and then external rotation, internal rotation, and the lateral stabilizers. Those are all just movements that the musculature that are noted under them will control. So, for example, the biceps femoris, which is a knee which moves the knee into extension, also controls tibial external rotation. And this was on your worksheet as far as what are the major knee flexors and knee extensors. So make sure you're aware of that and that you know that. Here's a diagram of that. And so make sure that you're understanding that the major knee flexors are going to be the biceps femoris, the semitendinosus and semimembranosus, as noted here. And the main knee extensors are going to be the quadriceps femoris, which includes the vastus intermedius, the rectus femoris, vastus lateralis, and vastus medialis. The vastus medialis is going to be, in your textbook, it's going to talk about how important that the role of this muscle is, because you're going to, a lot of the patellar tracking is done by all the lateral musculature. It's a lot bigger. So if this vastus medialis is very weak, then there's really not much to keep it in line. So that's going to be one of the major muscles to control patellar tracking. The other thing to notice in this diagram is the pes anserinus, or pes anserine, which is on the medial side, is created by the tendons of the sartorius, gracilis, and semitendinosus. Just beneath that is where the MCL will attach. In this figure here, we're looking at the posterior knee. One of the things that I will point out here is the semimembranosus bursa is located around this area right here. So when we look at swelling in the posterior knee, that's one of the things that we have to account for, that the semimembranosus bursa will be located right there. In this next slide, we're looking at the different ways to prevent the knee, and according to your book, here's several ways of doing that. One is physical conditioning and rehabilitation, and as we move on to the other slides, you'll see that there's some prevention programs, and one of the other things that isn't noted on here is the attention that the glute muscles are receiving. So, for example, the gluteus medius, and I'll go over this later in the lecture, but that's one of the muscles that will control external rotation of the hip, and as you'll see in further slides, that's going to be very important, along with all these other musculature, so the quad to hamstring ratio, gastrocnemius, strength and flexibility. The other thing to look at is shoe type and design. When looking at what type of cleat to choose, depending on what population you're working with, you may choose to go with the shorter cleat length so that your foot does not get stuck completely in the ground as you're trying to plant and turn or plant and pivot. And then the last thing is functional and prophylactic knee braces. These are used to prevent and reduce severity of knee injuries, but one thing to note is, or to, I guess, one point to debate is, is it going to be something that's going to eventually inhibit an athlete with them having to rely on that knee brace if you're just using it prophylactically? And is it going to decrease their kinesthetic awareness to the point where if they're not wearing it, then they're not going to be as stable, they're not going to feel as comfortable, and they're not going to be able to deal with the different stresses and forces applied to the knee as they participate in their event. And here are some pictures of the type of braces that can be used. And some of these, like it said in the slide before, can be used prophylactically, as in for prevention, or they can be used post injury, after surgery, or after coming off a moderate sprain. And you you have to make a choice whether this is something that the athlete's going to wear for the rest of their career, or if it's only for a period of time, and how are you going to take them off of that, the use of the brace. There's also knee taping. Here's some examples of that. And again, you have to decide whether or not you're going to use this for a long-term or just a short-term use. Here's a verse from the Bible, from Proverbs. It says, "A prudent man sees danger and takes refuge, but the simple keep going and suffer for it." And to apply this to what we're talking about, it's if you notice a certain biomechanical error that an athlete is performing, or there's something incorrect about their the way that they have landing mechanics or running mechanics, anything abnormal about their gait, and if you see that, the verse is basically saying if you're prudent, then you'll try to find a way to fix that. But if you're not, you know, persistent, if you're not trying to do the best that you can at your job, then you're just going to ignore it, or just really not look into how to fix that problem. And as a clinician, you always want to make sure that you're giving your clients, your patients, and your athletes the best care possible. So in this next slide, we see some examples of programs that have implemented ACL prevention programs. And one of the first ones that we look at is a PEP program, or Performance Enhancement Program for the ACL. And in this program, they implemented a ACL prevention program on middle school age females that played lacrosse, basketball, the sports where they saw most non-contact ACL injuries. And they did it through their whole career in the middle school, and then they followed them through high school and through college, and just did questionnaires, asked them if they were getting injured, if they had ACL injuries, and they were able to find that they were starting to see a decrease in number of ACL injuries. And that's just one study, but all these programs here are just very innovative, because they're trying to prevent ACL injuries, specifically in females, because that's where you see a lot of them. Here you see a snapshot of what a female looks like pre and post prevention program on landing. So this is what the female's knees look like after she jumped off a box and landed. And as you see, the knee collapses. There's a lot of valgus force, so it places a lot of stress on the MCL and the ACL. And post prevention program, you see a lot less valgus stress. They're loading more on the hips, so they're getting more knee flexion and putting less stress on the ACL and the MCL. Here's some of the other things that the program's focused on: improving balance in single leg and sport-specific positions, improve body positioning and gait mechanics, body strengthening plyometric training. So that's one of the things that many of these female athletes weren't really training, like they weren't doing any type of plyometric training, and through this program they learned how to do a lot of that type of training. For example, in that case, it was a lot of landing technique, so using a lot of their muscles eccentrically. Another thing was multi-plane and multi-joint movements, which they had never really done, and it taught them how to react to different forces and different angles. And overall, a lot of these programs have gotten a lot of good results with those prevention programs.